Today we're going to be talking about an interventional radiology option to treat an enlarged prostate. You see, most men, as we get older, our prostate enlarges and that can block our urine outflow. That can cause increased urinary frequency, difficulty urination, sometimes pain on urinating, and waking up in the middle of the night multiple times. This is called benign prostatic hyperplasia, meaning it's not cancer, it's a different part of the prostate that gets enlarged, but it can cause a lot of problems, as you know. The traditional treatment for benign prostatic hyperplasia includes medications like Flomax and finasteride. And if the medications don't work, then you proceed to something called a TURP. TURP stands for transurethral resection of the prostate. That means they insert an instrument through your penis and go shave the prostate from the inside. For larger prostates, traditionally, you would require a simple prostatectomy, which when essentially almost the entire prostate is removed. There are also new treatments like Resume and aquablation that are similar, but a little bit less invasive. All these procedures work really well, but you may have heard they have risks, including a risk of incontinence and retrograde ejaculation. And that's where the prostate embolization comes in, because it's less invasive and has less recovery time. Prostate embolization certainly works better than medications in improving your symptoms, but it doesn't work as well as a TURP. But it has less side effects and less recovery time. It also is done with only sedation, or even can be done with local anesthesia. It does not require general anesthesia, so it's more suitable for patients that have advanced medical conditions. There are some other advantages. It can be done without stopping anticoagulation, for example, and usually does not require the placement of a catheter. Prostate embolization is when we put a small spaghetti catheter to the wrist, usually to your left wrist, and then we can navigate all the way to the prostatic artery, which is a branch of the iliac artery. We navigate this tiny catheter that is less than a millimeter into the artery, almost all the way to the prostate. Once we're in position, then we inject these little micrometer beads. They're smaller than a millimeter, that will block the blood flow to the prostate. Because the prostate is very vascular and requires a lot of blood flow, once you block the flow to the prostate, it will tend to shrink over time. Patients can do their normal activities by next day, including driving and even playing golf, although some patients may have some urinary symptoms for a few days after the procedure, including urinating more frequently and pain on urination, almost like if you had a UTI, but it's just related to the embolization. Prostate embolization does not have any risk of incontinence or impotence. This is Minimally Invasive Insights, and I'm Dr. Fabio Komlos.